It's a lifesaver for me. I mean, I really can't say anything else. They saved my life.
I'm going to call the Clearwater Free Clinic a miracle.
It's a life-saving place that Clearwater really needs.
The Clearwater Free Clinic is compassionate, caring, and a necessity.
These are the feelings of some of the members of our community who use the Clearwater Free Clinic.
Behind this unassuming exterior, marvelous things occur. People are healed. People are loved. People are cared for.
The clinic operates currently on a $1 million budget, and we provide $5 million worth of services to the community.
2012, I think it was, I had a little sore in my mouth, and I wasn't saying anything because I thought it was just, just a canker or something, Come to find out it was cancer that Jan found. She had it checked out. She sent me to all the people I had to go see.
I'm a diabetic, and my legs swelled up because I was sleeping in my car and never horizontal. So I knew I needed some kind of medical care right away, and I came to the free clinic, and they got right on it.
I suffered a pulmonary embolism, and I had to report to the emergency room, and they referred me to the free clinic for further treatment. I am self-employed, so my income fluctuates up and down, and being able to afford insurance on the monthly basis is not something I can do right now.
There's a lot of people that wouldn't be able to get their medicine without the clinic, wouldn't be able to get proper health care without the clinic. It's just, my sister has problems in another state. She doesn't have this clinic, and she's having a lot of trouble. So, I'm just so grateful that they're here and that they, are willing to, or the volunteers are willing to help people, and it's just such a good place.
Well, I think it's really a viable issue here that we do need this facility. There are so many people who are underserved by the medical community for many reasons, but mostly insurance.
First of all, our hospitals would be filled with non-emergent chronic diseases. When you think of 75% of the people that we see at the clinic, and that number at this time is 4,000 active patients, have one or more chronic diseases that need to be monitored and need to receive medications and labs. And the chronic disease, if it's left unmonitored, develops into an acute problem that they end up in the hospitals.
We know that about a quarter of the population in Pinellas County has no health insurance, and about a quarter of the population earns a low enough income level to fall within our guidelines. And we don't treat a quarter of the people in Pinellas County. We know there's lots of potential to treat more people.
I myself see anywhere from 10 to 15 patients a day at the most. I spend a good deal of my time, as I said, doing a lot of the oversight, reviewing all of the clinical input that comes in, the laboratory studies, all the diagnostics, everything that all the doctors do as volunteers here, I follow up on, and I coordinate the continuing care after that.
The professional team that works here, I think, is great. I really enjoy and love working with them. They're efficient. Most importantly, I think they love the patients. They want to serve them, and I think that's the attitude I want to also project. And so we work great as a team together. I'm always happy to come. It's a great environment to work in.
I saw the pleasure with which the volunteers and the staff called people for their appointments. I saw the smiles on the patients' faces as they went in to see their caregivers. I watched people leave with medication in hand, sometimes hugging the caregivers as they left. And in those 6 or 8 minutes that I sat in the lobby, it was like an instant education about the Clearwater Free Clinic. And I knew when I walked in the door to talk to Jeannie Shapiro that I wanted this job.
I enjoy working here immensely. I think it helps me out as much as maybe it's helping out our patients.
We provide a basic service that grows into a more comprehensive and continuum of care here that in another setting for their situation, their psychosocial situation, they won't find that anywhere else.
We look to a variety of different funding sources, and one of our largest funding sources, of course, is our own community.
I would probably ask for bigger facilities, more rooms, because it's already getting crowded here. Some of the equipment that I had brought up just doesn't quite fit the room, and it just seems to get more and more compacted.
We've currently outgrown our 2 buildings. There are programs we'd like to provide our patients, expand our mental health, and provide services that are currently unavailable to the low income.
We treat people who are unable to access health care. They're the working poor, yes, but many of our patients are still working but unable to access insurance. Our goal is to keep them working, keep them functional as optimally as possible out there in the community so they can be a productive citizen.
There's a perception in the community that our low-income patients choose not to have health insurance. And in essence, they're right. They do. They choose basic needs over medical needs. And they shouldn't have to do that.